Good morning, good afternoon, and good evening. Welcome to 1509th day of continuous and uninterrupted Zoom session of IFPH. Let us start today's program with a silent prayer for 1 minute. Thank you and welcome back. Today we have with us Dr. VAIDEHI K. BHATT. His post-graduation in materia medica from Hemachandra, North Gujarat University. Worked as assistant professor, lecturer at Rajkot Homeopathy Medical College. Hundreds of publications, research activities, scientific activities. It will take another 10 or 15 minutes to go through all this. So I'm not going to do all these things. I welcome doctor. And today's topic is revitalizing veins, the homeopathic solution for varicose vein. Quite interesting and important topic. Not easy to control such cases. On behalf of IFPH, I'm back Dr. VAIDEHI. You can have the platform for next 40 minutes. It's over to you. Please proceed.
Thank you, Manoj sir, for the introduction. Good evening, everyone. Good evening to the audience of the IFPH platform. Thank you, Sahani sir, for again inviting me for the new topic. Can I start, sir?
Yes, of course.
So, today's topic is revitalizing vein with the help of homeopathy. So, homeopathic solution for the varicose vein. We are going through the multiple fragments of the varicose vein. First of all, we are going to understand about what is varicose vein. So if we are going to understand about the varicose vein, first we have to go through the veins. Veins plays a critical role in circulating blood back to the heart. And the healthy veins have the one-way valves ensure blood flow in the correct direction. It is from the reverse of the gravitational flow. When these valves weaken, blood can leak backward and pool in the veins, leading to the varicose veins. So most commonly it is found in the legs, as standing and walking increases the pressure in the veins of the lower body. So what is the definition? How we can define the varicose vein? So varicose vein are nothing but the enlarged, swollen, twisted veins that appears as like dark purple or blue color and the enlarged or swollen part, maybe in a limbs, on upper limbs, or in the various parts of the body. They develop when valves becomes weak or damaged, causing blood pool and veins to stretch. So what are the prevalence of this varicose vein? Why we are giving importance to this varicose vein? So if we are going to the prevalence or epidemiology, we can find the 10 to 30% of global population are suffering with the varicose vein nowadays. Among them are 20% goes to women part and 10 to 15% goes to male part. So, if it is defined by the age, we will find the around 30 to 50 years of age or more than 50 years or more than 70 years of age will suffer with this venous disease. And it is moreover more common in a woman. So, one man and it is equal to 3 to 4 women. So, suffering is more in a woman. It is due to the hormonal factors, especially during pregnancy, menopause, and from using hormonal replacement therapy or by going through the ART or birth control pill. And if we go through the geographical variation, in Western countries, we have the highest prevalence of this varicose vein. And nowadays in India, 10 to 15% population is suffering with the varicose vein. It is due to the changes in a lifestyle or occupational factors and many more causative factors that are increasing in India also nowadays. We are going it in detail furthermore. Next is the impact of pregnancy, and it is more common during the pregnancy due to the increase in pressure in a intra-abdominal cavity. Then person having a family history of varicose vein will more suffering with the same complaint. Then if we compare the urban and rural prevalence, we will find the more cases in a urban population compared to rural. It is due to the awareness and it is due to the sedentary work and lack of physical activity. And biggest problem which I have taken in my last session, it is the obesity. So about 1 in 4 adult is worldwide suffering with the varicosity, and it is 50% common suffering in a person having more than 70 years of age. So 30% of world population is suffering with the varicosity. Now, what is the pathophysiology? What are the causes? What are the risk factors? First of all, we have the basic understanding of normal veins and varicose veins. So, normal veins have a one-way valves and they keep blood flowing back to the heart, and they appear as thin, flat vessels visible beneath the skin. And in contrast, varicose vein have weakened, damaged valve, causes blood pool to resulting in a swollen, twisted, and bulging vein. These are the basic structures of vein. What is the pathophysiology behind the development of varicose vein? So, normal venous circulation, as I told, one-way valves have to prevent the backflow of blood. Spatially, it will help in a muscle contraction and pump blood upwards against the gravity, especially in our legs. So, if valvular dysfunction occurs, this varicose vein that preventing from the one-way circulation, they get weakened, damaged, and that will lead to venous reflux. That's why blood flows backward and pool of veins will occur, and that will causes increase in a pressure inside the vein. Next is the venous hypertension and vein dilatation. So this prolonged venous reflux is leading to the increase in a pressure of the superficial veins, and that will lead to stretching of the veins and dilated veins and having a twisted and large appearance of the veins. Then the inflammation and changes in a veins wall. The high venous pressure leads to the inflammation and damage to the inner lining of the veins, and this inflammation process will lead to the thickening and fibrosis and ultimately scarring of the vein walls. And if it will remains for the longer time, the veins become tortuous and blood remains stagnant at the same place. That's why skin changes will occur. That's why there will be a itching, discoloration, and thickening of the skin. And that will lead to injury, and injury will lead to formation of the ulcers. So venous pooling and symptoms. So blood flooding in venous causes swelling, heaviness, aching, and visible swelling and twisting of the veins on the skin surface. So this chronic venous insufficiency also lead to the complications like venous ulcer and skin discolorations. So basic pathophysiology of development of varicose veins are: there will be a valvular dysfunction leads to incomplete valve closure, lead to blood pooling in the veins, then vein dilatation will lead to elongation, then chronic venous if insufficiency will lead to development of this pain, heaviness, and visible twisted veins. And then it will lead to complications like ulcers, eczema, bleeding, and DVT, deep vein thrombosis. So what is the evolution of the disease in case of varicose vein? First of all, there will be a development of spider veins. It mostly found in the legs and face. It is similar to varicose vein, but they are smaller in size and they are not swollen than the reticular varicose vein, and they are appear as a blue or green in color, that are smaller than the spider veins, and they are the caused by the weakened and damaged valve. And later on, this reticular varicose vein will lead to development of the varicose vein. So what are the types of varicose vein? As we know, varicose vein are commonly or mostly found in a leg. It doesn't mean that it will not occur in any other part of the body. Legs are the common place, but it can occur in any other part of the body. So first is the trunk varicose vein. It can occur on the skin, or it can occur usually on legs. There will be a large swollen, often look like twisted rope-like appearance, and it is visible prominent vein-like structure which causes pain and heaviness in a leg. Then the reticular varicose vein, that are the smaller flattened veins. They are deeper, they will found in a deeper surface, and they will appear as a blue or green in color, and they are less painful. Mostly we will find this reticular varicose vein around the trunk varicose vein, but they are not causing discomfort as like the trunk varicose vein causes. Then the telangiectasia, that is the spider veins, they are closer to skin surface, openly in a legs and face. They are small, thin, red, blue veins, appears like a web or branching pattern, and they are typically painless. So persons are not giving importance to them. If it is cosmetically visible, then person are taking care of that. They are very small and they are not causing typical type of varicosity pain. Then the perforated varicose vein, it is mostly occur in a perforated vein which connects the superficial vein and deep veins, and these are due to the malfunctions of the valves, and that will lead to the backward flow into the superficial vein from the deep vein, and that will lead to the deep or swelling and appearance like a varicose vein or pain and itching and complications of varicose vein. Next, the deep varicose vein. It occurs in a deeper vein of the muscles and leg, and it will causes complication like blood clots or deep vein thrombosis. And it is usually we can diagnose it with the Doppler test or with the ultrasound measures. So if we classify the varicose vein, we have to classify it under the two category, primary varicose vein and secondary varicose vein. In primary varicose vein, it may be developed due to the intrinsic weakness of the valves, and in secondary varicose vein, it will develop due to the increase in a pressure of the superficial veins due to some medical condition, trauma or deep vein obstruction. So always we are going to find out some deep vein thrombosis or any other tumor, pelvic tumor or reflex or any other disease condition or chronic venous insufficiency to cause the secondary varicose vein. And in a primary varicose vein, there may be changes in a hormonal pattern and prolonged sitting or standing posture, obesity, and that will lead to the development of the varicose vein due to the weakening of the valves. So if we are going to categorize this primary and secondary one, primary one having without any medical complication and or trauma, they may develop due to the normal physiological changes with the pregnancy. But yeah, it will also causes swelling pain and visible twisting pains and complications like secondary varicose vein and uh, somewhat like a pain, but it won't remain for the longer time. That's why it won't causes varicose ulcer. Next, in secondary varicose vein, there may be a development of DPT having a history of trauma and chronic swelling and deep vein thrombosis. And that's why it will lead to the development of complications, deep vein thrombosis and varicose ulcers. So these are the stages of the development of the varicose veins. The first one is the development of spider veins, in which, as I told you, it will develop like a wave-like veins, and it don't look good cosmetically. Then the varicose vein itself, they are enlarged, swollen, and visible bulging under the skin, and it will causes swelling, discomfort, heaviness, even cosmetic concern like a spider veins. Then the stage 3 leads to edema. Stage 2, that is varicose vein, if it is remain for the longer time, that will lead to noticeable swelling in the legs and around the ankles and calves. And thus symptoms, if persists, that will lead to the, it is persist for the longer time, that will lead to the swelling and heavy and tired legs. Then the skin changes due to this continuous swelling in legs and edematous changes in legs will lead to the skin discoloration, that is the brownish or reddish pigmentation. And this pigmentation will lead to the itching due to the continuous pressure in a leg, and that continuous itching will lead to development of eczema, So eczema is like dry, flaky, itchy skin, and it also causes the lipodermosclerosis, that is the thickening and hardening of the skin at the particular region. That region, in that region, person having a continuous itching and eczema and irritation like appearance. Than the healed venous ulcer. So this thickening of the skin caused by this edematous or eczematous condition will lead to development of the ulcers, and the skin remains fragile, tight, and around the areas, and this active venous, and that will lead to the development of active venous ulcer. So there will be a development of open sores and causes severe pain. There may be a oozing of blood, or there may be a changes in a deep cavity formation, and that will lead to infection also, and that are very slow to heal. So what are the risk factors? It is related with the age. As we told you, it is more than common in a more than 50 years of age, having a family history of development of varicosity, lifestyle changes, sedentary lifestyle, tight clothing. Then environmental factors can increase the risk of this development of varicose vein, having some medical conditions like DVT, having formation of thrombus, or it is more common in females. So what are the exact etiological factors for the varicose vein? Genetic factors are there. Now, if someone having a family history, that person are having an increased risk of development of varicose vein, then it is common in a elder individual having a loose elasticity and weakened valves. That aging will causes wear and tear of this vein valves, and that will allow blood flow to backward. Then the hormonal changes, this hormonal fluctuation will weaken the vein walls. Then the pregnancy due to increased pressure in a pelvic cavity. This hormonal changes during pregnancy will contribute development of varicose vein. Menopause, it is due to the deficiency of the estrogen or continuous use of the contraceptive pill or birth control pill or HRT can weaken the valves. That will lead to the fluid retention and weight gain also. Then the prolonged standing or sitting, that will lead to development of this stagnant or poor blood circulation, and development of the stagnancy will lead to the development of venous issues. So person having occupation like a teachers or nurses or rail workers or police or traffic police having a continuous standing or sitting posture are at the greatest risk. Then the again pregnancy having an increased volume, pressure from the growing uterus, and hormonal changes. And all of this also comprises with the development of the obesity. So itself, obesity will lead to the development of the varicosity of the vein, and it will causes the increased pressure in the veins and harden the veins, and that will lead to back push blood to the heart, and that will lead to blood pooling and development of venous enlargement. Then the lack of physical activity, that is sedentary life, will changes in pumping of the blood from the legs. Then the trauma or injury also damages the valve. Then increase abdominal pressure, like in a pregnancy or chronic constipation or chronic coughing or lifting heavy weight or some liver pathology can causes the increased pressure in abdominal cavity, contribute to development of varicose vein. Then the chronic venous insufficiency CVI will lead to the valvular failure and vein wall dysfunction. Then the congenital conditions like Klippel-Trenger syndrome, which involve the abnormal vein development. And this rare congenital condition will also lead to the varicose vein development during the or at the time of birth. So what are the clinical features of the varicose vein? What are the problems faced by the patient by development of varicose vein? So first is the visible swollen veins, and this visible swollen veins are enlarged, twisted, bulging vein having a blue or purple color, and there's a rope-like lumpy structure developed under the skin and visible on this chronic long time standing and sitting, and that will lead to development of leg pain and aching. Now having a dull aching, heaviness, throbbing, burning sensation, and that will relieved with the elevating legs or with the movement of the legs. Then the leg swelling, swelling particularly around the ankles and then on the calves, and that will also reduces during the elevation of legs and resting and get aggravated with the standing and sitting posture. Then the heaviness and fatigue in the legs, and due to this swelling and heaviness, there will be a development of tiredness and fatigue, and person getting tired by walking. So lack of walking will causes the development of varicosity, and varicosity will lead to decrease the physical activity of person due to this fatigueness, tiredness, and heaviness of the legs. Then the skin changes. There will be a development of dark brown or red patches. It is due to the development of continuous edematous conditions in a leg that will lead to dry, scaly, itchy patches, hardening, thickening of the skin, especially in a lower legs. And now skin becomes fragile due to the thickness, and that will prone to injury. And this in edematous skin, discolor skin hardening will lead to development of itching and irritation and lead to venous eczema. That next is the leg cramping. Muscle cramps are there, especially at the night. And if it is, there will be a more sitting and standing period that will lead to muscle cramps, especially in a cows, and that will lead to discomfort during sleep. Then the restless legs syndrome, a tingling and clawing sensation in a leg, especially in the evening during rest, and that will lead to discomfortness and lack of sleep or disturbance in the sleep. This chronic condition will lead to development of the venous ulcer. These are the open ulcers, especially occurs around the neck or inner tibial surface, causes very much pain, and they are very slow to heal due to stagnance of the blood flow, and that will prone to infection, and this part become discolored, hard and swollen. Then this superficial thrombophlebitis, inflammation of vein just beneath the surface of the skin. Sometimes it is associated with the blood clot also, and this look like a tender red, and they are warm to touch, and that will causes pain and swelling around the vein. Next is the bleeding. If this varicose vein will become damaged due to this itching and continuous bulging, this minor trauma will lead to the rupture of this bulge varicose vein and lead to bleeding. Now, how will diagnose it? There are the various tests or examination that can help us to diagnose the varicose veins. First of all, we are going through the history of the patient, and in that, if we are going to differentiate between the primary and secondary one, we have to go through the patient history, and for that we need a medical history of the patient, family history of the patient, pregnancy, occupation, even history of the trauma, surgery, and different thrombosis, and lifestyle of the person, like physical activity or any other addictions like alcohol and smoking, because it will causes the thickening of the intima of the vessels. So the person having symptoms like leg pain, heaviness, cramp, or swelling, as we know this changes, we have to take the history of the symptoms also. Then the visual inspection. By the inspection, we can inspect the visible varicose vein or spider veins, skin discoloration, eczematous conditions, swelling, or venous ulcer. If there is the long-term consequences of varicose vein. Then in a palpation, we will find the tenderness, pain, warmth, inflammation, sugar, and hardening and thickening of the skin. Then the functional tests are Trengenberg's test. It is mostly we are going through this test for the superficial veins. Then the Pathophysiology test is for the deep veins. Then the Doppler ultrasound, which are normally or commonly used nowadays, and it is the gold standard to confirm the varicosity, especially in deep vein thrombosis or DVT. So we can identify the venous reflex and blood clots and valvular incompetency with the help of Doppler ultrasound. Then photoplentimography, and that will help to the find out the venous return to the heart, and that's why we will diagnose the venous insufficiency condition related with the heart. Next is the ankle brachial index, and that will also help us to find out the arterial and venous insufficiency. Then the magnetic resonance venography or MRV or CT venography, that will help us to find out the exact anatomical condition of the valvular structure or venous, especially in a deep vein involvement. So these are the different method of the treatment from the allopathic side. So what they are giving, what are the conservative management? So first of all things or all member or all system are advised to have lifestyle changes. Then the other therapy. So first of all, conservative management. So first of all, we advise person about the lifestyle changes to do a regular physical activity, walking, cycling, that will improve the circulation and venous return. Then the weight management, maintain healthy weight, reduce obesity, reduce your weight, so that will lead to relieve pressure in the leg veins. Leg animation after the continuous hectic work or standing or sitting, that will also improve the condition. Then avoid prolonged standing and sitting. Rather than sitting and standing on the same posture, start walking. Then wear loose fitting clothes. So this tight clothes, then the skin is not able to breathe properly. So we are advising person to wear a breathable fabric like cotton, where there will be a development of varicose vein. Then the simple routine, start a short walk, like a simple activity rather than going on a bike or travel small distance. Take a small walk to do your regular activities. Then quit smoking, because smoking will lead to the thickening of the valvular structure, and this will lead to the valvular incompetency and later on development of this varicose vein. So quit smoking. Then compression therapy. Compression stockings are advisable to person to maintain this blood flow, that will prevent the blood pooling backward or reducing swelling. So it is advisable for the mild to moderate varicose vein, and it will effective for the relievance of the pain, swelling, and further venous enlargement. So many minimal invasive treatments are there, like sclerotherapy, then endovenous laser therapy, radiofrequency ablation, foam sclerotherapy, and next will be the surgical treatment, which are advisable during the deep vein thrombosis or severe varicosity, and in which a vein ligation or stripning and ambulatory phlegmectomy are done. Then the treatment of the complications are depending on the complications occur due to the long-term invasion of the or development of the varicose vein. If development of the varicose ulcer occur, we require the treatment of the same and surgical invasion or compression for the same. Then the superficial thrombophlebitis, if it is occur, with giving the anti-inflammatory measures from the conservative treatment. What are the alternative or complementary therapy? Some herbal supplements like horse chestnut extract or Bachelor's broom can help this. Or sometimes laser treatment of will help to look cosmetic look for the spider wings. So what are the advisable diet for the varicose vein? We are always advising to have a fibrous food, legumes, avocado, beans, to reduce the intra-abdominal pressure to prevent chronic constipation, and that will lead to decrease in pressure in abdominal cavity and ultimately in a leg. Then the flavonoid-rich diet, like flavonoid having onions, spinach, broccoli, peppers, and that will help to blood to thicken, prevent blood from thickening, and they will help to blood to proper flowing, and that will prevent the pooling, and that will act as an antioxidant and reduce the inflammation. Then the potassium-rich supplementation, almonds, or you can say dry fruits, beans, potatoes, and green leafy vegetables will helps to reduce the swelling of the varicose vein and helps in a retention of the flow. Now the homeopathic approach. So first of all, I'm giving importance to GNM theory always. So in a GNM theory, if we going through it, it is related with the mesoderm. Valvulars are or vasculatures are developed from the mesoderms, and mesoderm is always related with the self-devaluation conflict. So if it is in a conflict active phase, there will be a localized necrosis, there will be a development of the necrotizing intima, means there will be a development of the valvular deformity and thickening. And in a healing phase, there will be a development of the loosening of the elasticity of the vessels that will lead to the chronic inflammation and phlebitis, giving red, warm, and tender look, and that will easily attract the bacteria to infect. So, in controversial medicine, swelling in a leg are often misdiagnosed as vein thrombosis or thrombophlebitis. And this varicose vein are hanging healing in the leg veins caused by the continuous conflict relapses. So if there is the continuous self devaluation conflict, there will be a problem with the visibility or outward appearance of the body, and here it will give a problem with the cosmetic look. So varicocele can also develop due to the self devaluation, and that is associated with the testicles. And spider veins are developed due to the, again, self-devaluation conflict, as I'm not pretty, person is not accepted by her or him, and that will lead to development of this problem in a cosmetic look and development of the varicose vein. So what are the principal treatment of the homeopathic? From first of all, we believe in individualized treatment. So there is no general medication for the varicose vein like the other treatment of the medicine. We have to take the history from the physical, emotional, and lifestyle factors. We are believing in a holistic healing. So we are treating the physical factors as well as mental factors that are causing development of this varicose vein, like stress or poor lifestyle and habits and hereditary predisposition, which influences varicose vein. And if it is continue, we will take help of constitutional remedies to remove the fatigue or digestive problem or emotional stress or continuous maintaining course. So depending on the miasm, if we consider the sora, so there will be a development of weakness in a valvular structure that will lead to poor blood circulation that act as a predisposing factor for the varicose vein, and various emotional factors related with the sora like anxiety, restlessness will also lead to development of this physical symptoms. And in this condition, antisodic remedies like sulfur and calcarea carb will help us. Then the psychotic condition, in psychosis, there will be excessive growth or discharges. So chronic respiratory condition or urinary issue or emotional states like jealousy. So this continuous fluid retention as it is the tendency of accumulation in the psychotic miasm will lead to increased fluid retention, swelling, and engorgement of veins, and contributing to very development of varicose vein. And person having a continuous this emotional plain drainage or stress disturbances that will lead to development of this condition, where antipsychotic remedy like thuja and madorinum will help us. Then the syphilitic condition, Then it will be the continuous one, then it will lead to degenerative changes like development of varicose ulcer. And we know this degenerative changes are the characteristic of syphilitic miasm. So this chronic inflammation or varicosity will lead to development of formation of ulcer, and contributing a valvular insufficiency will lead to degeneration of the valves also. And in that condition, we can take help of anti-syphilitic medicine like mercurous and arsenic. So many medicines are there. I am giving examples of few remedies for the varicose vein. As I told you, we believe in an individualized treatment. But here are the few examples of the medicine we can indicate in a case of varicose vein. So first is the hemomylase. Hemomylase is a very good remedy for the painful inflamed vein. And veins feel bluish, tender, swollen, feeling of fullness, throbbing pain, and which will bleed easily. And hammermill is having a bleeding diathesis, and especially we will found in a legs, and with the aching pain and dull pain and bleeding from the varicose vein. Then the pulsatilla. We often prescribe pulsatilla in a woman. It is the you can say a female predominant remedy, and we will indicate pulsatilla during pregnancy. Will be indicated with the conditions like the heaviness of legs, and that can aggravate during warm environment and better by the open air. And it is also indicated in a restless leg syndrome. Next, calcarea floor having a hardened, nutty vein, hard, swollen, tortuous, and there will be a tendency to formation of ulcers. It will affect the large veins or deeper veins, or it is indicated in a chronic venous congestion with this stiffness. Then the arnica, and arnica, it is a very good medicine to relieve the pain by touching. A person having a fear of touch and having severe bluish pain with the swelling and tenderness of the vessels. Then the lachesis giving a bluish purplish look with the sensitivity to touch and throbbing pain which is aggravated on left side, and having a inflammatory changes, and it is always associated with the menstrual problems, and it will commonly found during climaxes. And next is the graphitis. It is suitable to, you can say, eczematous condition developed by the varicose vein. There will be a itchy, dry skin, ulcers, eczema, crusting, oozing. And there will be the sluggish circulation with the chronic constipation and itching and ulcer formation. Then the fluoric acid having advanced varicose vein ulcer, they are prone to development of slow to heal or punch out ulcer that are very painful, and person is restless due to the pain and burning sensation in a leg with the enlarged and noted veins. Then the zincum metallicum having again restless leg syndrome like pulsatilla having a cramp especially aggravated in a night, and this varicose veins are very painful especially in a night with this twitching and restless legs. Next, carbo-vegetables is again a good remedy like lachesis for giving a discoloration like bluish look or cold veins due to the stagnancy of the flow. It is indicated in a poor circulation, a person having a fatigue and weakness in the legs due to continuous edematous condition, and heavy and a cold feeling in the legs. Next is the vipera, very well indicated in this varicosity and very good affinity for the blood and blood vessels, hemorrhagic condition and inflammation of the vessels. It is a good remedy for the phlebitis and varicosity. And persons having a specific aggravating modality, they are not able to let their limbs hang down. It will causes pain or bursting sensation, fullness sensation, and having a very sensitivity regarding touch. So there will be a suffering of the gait, paralytic foot, acute phlebitis, swelling, sensitivity, bursting, and severe cramping pain in the lower legs that will lead to development of the boils, carbuncles, and ulcers due to the infection, and this infection will lead to development of gangrene. Then the anacardium, it is indicated in a syphilitic persons having aversion to work, sedentary lifestyle, and having a plug-like sensation or increased pressure in abdominal cavity and renal. And it is indicated in a varicose eczema with mental irritability, vesicular eruptions, swelling urticaria, and with severe itching. Next is the ferrum force. It is indicated for the varicose vein, especially in young persons, and it is also indicated in varicocele, development of varicocele, and it will also indicate some arterial disease also with the throbbing or severe kind of pain. It is also help to resolve the small aneurysms. Then the formica rufa. Debility will be the key feature of formica. Then there will be a inflammation, redness of the skin with the itching, burning, exudation, discoloration, and urinary changes, albumin present in a urine, blood in urine, urging for urine. There will be an increase in a pressure or incontinence of the urine or retention of the urine, and that will lead to development of changes in a uric acid diathesis and lead to gout formation and articular rheumatism, and that can appear suddenly with the restlessness, and this pain will aggravate by motion, better by pressure, and especially from the right side. Then the pyrogenum, it is indicated for the varicose ulcer, fevers, deep vein thrombosis, ulcerated legs, and which discharge freely, offensively, and extremely painful. Then the arsenic alb, it occurs in an elderly individual with severe burning pain, which is aggravated especially at night. Then the nux vomica can be indicated during pregnancy due to the high living. Then the belladonna and glonoin, which are indicated in a person having a hypertension, that will help us to reduce the pressure in vessels in a plethoric persons and rushes blood to head and throbbing pain of the vein. Then magnetis polyarctics, that will help in relieving the throbbing pain in a leg, hanging down with the feeling of hot water running down in affected part and fending on the walking. Then millefolium, hemorrhagic diathesis medicine is specially indicated for the capillaries. It is indicated for the spider varicosity, where the capillaries develop spongy and large, veins break easily, congested, and wound will break easily. It will lead to development of the bleeding from the varicose veins, and varicose vein during pregnancy with painful ulcerated filling in legs. Then the sulfur veins, ulcerated, rupture, bleed, especially in the extremities. There will be fatigue or tiredness. We can use sulfur as an intercurrent remedy to clear out the miasmatic condition. Then the peonia, as we know, peonia is a very good medicine for the development of piles. Ultimately, there will be increase in portal hypertension. So this condition will lead to increase in a pressure in a lower leg. So in peona, there will be a sensitivity, fullness, ulcers below coccyx, sacrum, burning pain, itching. Like Nuttall's chronic ulcer, lower body parts are very much affected in peonia, pain in the wrist and fingers, knees and toes, weakness of the legs, and it will lead to inhibiting walking. Then the Calcarea iodata. Calcarea iodata is indicated for the indolent varicose ulcers, and person will easily perspire, and this ulcers will give a coppery color look and papular eruption, tinea fevers, crosstalgia, thickening of the skin, and swelling of the glands and skin cracked and falling out of the hairs. Then the thuja occidentalis, person having due to this edematous condition, person having a filling of legs are made up of wood and glass, and that will break easily, and that will give a red filling or muscle twitching, weakness, trembling, cracking in the joints, pain in the heels and the tendo Achilles, and this will lead to rapid exhaustion, emaciation, especially indicated for the left-sided affections. It is chili medicine. Then the Magnifera indica, it is the very good remedy for the passive hemorrhages from the various outlet of the body, and it is also causes the relaxation of the mucous membrane of the alimentary canal also, it will cause serous discharge. It is indicated for the chronic intestinal irritation with the drowsiness or atomic condition. Poor circulation and relaxed muscle will lead to development of varicose vein in case of magnifera indica, with the itching of the affected part and discoloration of the skin. Then the polygonum, it is indicated for the maturation and amenorrhea, especially in young girls with the varicoses, hemorrhoids, and the formation of the rectal pockets. And it is indicated for the female who are having a varicose ulcer, a superficial one, or having soreness, especially during the climatic phase. Next is the Balis paranus. So Balis will help us to relieve the bluish sore feeling with the venous congestion, swelling, sensitiveness, exudation where joints feel sore, muscular soreness, itching on a back, and having a pain like a sprain around the joint, and having a band-like sensation around the joint. Then the alumen will help to recover the ulcers like fluoric acid indurated one, and it is developed due to hardening of the skin, induration or vessels will bleed easily. Weakness of the muscles, especially of the arms and legs, will lead to fatigue and concentrated feeling around the lips that are aggravated by cold, and it is relieved by the warm stuff apart the headache, having a cross modality in case of headache. Next is the batch flower remedies. As we know, this cause, according to GNM theory, emotional pain plays an important role in the development of varicose veins. So various batch flower remedies will affect the development of or relieving the varicosity, like crab apple. It is feeling of shame or self-disgust. Millimans having a potential complication of fear of unknown things. Oak having a overworking or strong sense of duty lead to physical exhaustion. Then the olives, exhaustion and fatigue for the long-lasting issues. Rescue for the stress, anxiety, trauma. Walnuts, like difficulty in adapting change, lifestyle changes that are necessary to managing varicocele. Then the larch, there will be a lack of self-confidence. Sweet chestnut, feeling of despair and hopeless. Gentium, there will be a discouragement or lack of motivation, health issue. Star Bathinum, having a shock, trauma, physical or emotional. So these are the batch flower remedies. Some of the biochemical remedy will also help us to recover from the varicose vein. Calcarea floor. Calcarea floor having a very good effect on the strengthening of the blood vessels and develop the tissue elasticity. Natramure will regulate the fluid balance in the body and also helps in the reducing the swelling and fluid retention. And then the silicia will play an important role for repairing of the tissue and strengthening of the connective tissue, and that will help in improving blood circulation and recovering of the ulcers also. And then the ferrum force act as a blood tonic, having an anti-inflammatory activity, which help us to develop the circulation, proper circulation, and with the reducing of the inflammation, and that will lead to decrease in a pain. Then the Kali self supports the cellular metabolism, and it is essential stuff to develop the normal healthy skin and mucous membrane. It will reduce its itching irritation by improving circulation, and that's why it will prevent the formation of the thickening of the skin and ulcer of the skin. Then the natrum force having a acid base balance of the body, and it will help to improve the overall health and reduces the chances of venous congestion. So depending on the condition, we can give the different doses of the biochemic remedies, or we can use this medicines in a combinations also. As we know, these are the supplements or source from the Suzzlers. So in a repertorial approach, various rubrics we can find in a various repertories with the lot of medicines indicated for the various complications or various indications or various clinical condition with the varicosity. In Murphy repertory, it is given under the veins or subrubric varicose. It is given under the clinical rubric veins. And boric repertory, it is given under chapter circulatory system, having a rubric veins, subrubrics veins, varicose, and extremities, and a synthetic repertory and painfulness, especially in the lower limbs. So how we can manage the complications with the homeopathy? We have lot of medicines to manage the various complications of the developed due to the varicosity, like varicose ulcers. We can indicate graphitis silicea, calcarea 4, as we already know the indication of these remedies that can help and promote healing and reduces discharges and relieves the pain. Then the superficial thrombophlebitis, we can indicate Haemophilus laecosus, vipera to reduce the inflammation, tenderness. Then the venous eczema, we can utilize graphitis, sulfur. We can utilize fluoric acid to reduce the itching, eczema, thickness of the skin, cracking of the skin. So depending on the case, homeopathic repetition of the doses and selection of the medicine will change, but it will require lifestyle changes with the long-term therapy as it is developed due to the chronic condition. Then what are preventive measures we can advise with the homeopathic medicine? It is the regular follow-ups, lifestyle changes is most with the medicine, and we can indicate some constitutional remedy to relieve the threats. So what are the benefits of taking homeopathic treatment? As we know, it is non-invasive, so there will be no invasive surgery. It is holistic, so that will help you to relieve your mental, emotional pain as well as physical suffering, and it will give you long-term suffering. Here is the one case, person, a male patient of 57 years, working as a employee in a government sector, comes to clinic with the swelling of both the legs and skin eruptions. With the past 6 months, we have taken the history. Having he has addiction of smoking and alcohol and hypertension due to this bad habit, and he has the history of formation of deep vein thrombosis, and he was undergone the specific treatment from the conservative measures to relieve this deep vein thrombosis. We are having a history of complaint. At presently, he is suffering with the this swelling of the both the lower limbs and having a dry scaly crust, bleeding, having a itching, irritation, and it is started with the left leg, and then later on it will started on a right leg, and left leg having a old eruptions, so it have a cracks and discharges, and a right leg have a mild eruptions. All complaints of this individual are aggravated by covering and warmth, and better by scratching, cold application and covering. And in a family history, his father having a hypertension and diabetes, and the person having a past history, as I told, having a history of deep vein thrombosis, and taking the treatment of this hypertension, there is no any allergic condition. He's taking mixed diet and thirst is normal, having desire for sweets, having addiction. Sleep is disturbed due to the complaint, thermos, he is hot patient. At present, blood pressure is normal. He's very emotional and intelligent as he is working under the government sector. He is very hard-working person, but having a lot of worries regarding future of son due to his poor studies and irresponsibleness in a work, and he is having a very responsibilities on a workplace and want to get respect in a society, and anxiety about his health due to son's behavior also. Then anger when somebody doesn't somebody does mistakes in a work because he is very typical or systematic in his work and very much concerned about his health condition. So after the repetition, we are finding the lacasis, calcarea, carb, sulfur, brownia, pus, smoke, and arsenic alb. But depending on the case, we are prescribing him lacasis due to the development of ulcers on the left leg with some oozing and thickening of the skin. And lacasis 30 was prescribed in a frequency of BD doses for the 3 days. And then it is followed by the placebo, and after 7 days he comes with the closing of this ulcer and having a pain, itching and swelling in her legs, and later on we continue with the further medications to relieve him. So depending on this things, homeopathic treatment for varicose vein is a very safe, gentle and effective approach that addresses individuals' overall health and underlying cause. So we will carefully select the remedies, and with the lifestyle modification, we can relieve the suffering of the patient without any invasive measures or surgical measures. We can improve the lifestyle and improve the circulation of the lower leg and prevent complications like ulcer and thrombophlebitis. We can reduce his recovered and cure the patient and manage the cases very well caused by the varicose veins. Thank you.
Okay, thank you, Dr. Vaidehi. It's a nice presentation. I think the slides are good and the presentation, the voice modulation is excellent. But we have to keep the time 45 minutes, so we need some discussion. But unfortunately, that wasn't happened. Only 2 to 3 minutes remaining. Then, what about the possibilities of the percentage success in such cases in your
Sir,
practice?
it will depending on the presentation of the case. If person comes on a starting case or having a spider appearance or only edematous condition of the legs, we will recover it fully. If there will be a development of the complications like the formation of the ulcers and eczema, then we require the long-term therapy. And it is more than 30 to 50% ratio that we can relieve this ulcer and eczematous condition in a 3 to 6 month max. But with the
Okay.
long-term therapy, recovered this varicosity.
Yes. This time to wind up the session, may I invite Dr. Thanesh to express word of thanks. Dr. Thanesh, please.
Yes, Dr. Vaidehi, it's as usual, you've made a brilliant presentation in this forum, and it was really an interesting one. We have a lot of cases coming every day with this varicose ulcers and varicose problem, and definitely homeopathy can do a lot of things with our prescriptions. Anyway, congratulations for the same, and
Thank you,
your
sir.
we can have some more presentation on this case presentation of this subject, because that will enable more patients to come to homeopathy. So we hope that you
Yes,
can
sir.
have second edition of the same with some 3 to 5 cases.
Okay, sir. For sure, sir.
Okay, I am thanking you on behalf of myself as well as International Forum for promoting homeopathy. Thank you.
Okay. Well, it is remarkable that around 30 medicines he mentioned homeopathy. Which system of medicine other than homeopathy can have that much number of medicines? That we must remember the remark. We conclude today's English edition. Hope you that will be back again tomorrow. Till then, goodbye. And Dr. Maria Majon to continue the program in Malayalam.
Thank you, sir.